Hello, everyone, and welcome to the Columbine Health System Center for Healthy Aging Speaker Series. My name is Allie. I'm the admin at the center and will be your host for today's presentation with Kris Geerken and Gilliane Lee from Changing the Narrative. The Center for Healthy Aging at CSU serves as a catalyst for interdisciplinary research, evidence-based outreach, and education about healthy aging. So we appreciate you joining us to learn about the great research happening in the aging field. If you'd like to participate in future speaker series, feel free to email me. I'll put my email in the chat. A few housekeeping items before I introduce our presenters. Please be sure to mute your microphones so that any background noise can be reduced. There should be time after the presentation for Q&A, and you're welcome to either unmute yourself and ask your question or type it in the chat. Also, we will be recording this talk so you can view it again or forward the link to friends, family, and colleagues. It'll also be on the center's website along with the rest of the series. Now I'll introduce our presenters. First with Kris Geerken, and she's the program manager for Changing the Narrative's Age-Friendly Healthcare Program. Through community education, she shares insights about the negative impacts ageism has on our health as we age and produces recommendations on what we can do about it. She previously worked for hospice, where she developed an advanced care planning training program. Kris also serves as vice president for the Colorado Center for Aging, an organization focused on advocating for policies to improve the quality of life for older Coloradans. She's being joined by Gilliane Lee. Gilliane has a doctorate in occupational therapy and completed her doctoral capstone experience in raising awareness about ageism. Gilliane works with older adults in a subacute setting and does advocacy work with Changing the Narrative to continue educating people about ageism. Thanks to you both. You can get started when you're ready.
Thank you so much, Allie, and thanks so much for having us today. We're really excited to share what we have learned about ageism with all of you. And for those that aren't familiar with Changing the Narrative, we're based in Colorado, and all the work that we do centers on educating individuals and organizations about ageism and the impacts it has in our lives. And we do that with different campaigns besides the age-friendly healthcare one that you're seeing here today. We also have one that's centered on workforce and bringing awareness around age discrimination in employment, and an intergenerational program that we have. So there's several different things that we have for the public. Lots of our resources are free on our website, so I highly recommend checking out our website so you can learn more about what we do and our work. So we'll get started and we'll jump right into our slides here.
Okay, so to get us started, we always want to go over what our goals are for the webinar. So for today, we would like for you guys to be able to learn about the different types of ageism that exists. This is for this one, it's focused on the healthcare system. Learn about recognizing your own beliefs about age, since it affects how you treat yourself and how you treat others throughout the aging process. Learning about intersections with other identities, learning about the negative impacts that ageism has on health and aging, and also ways to advocate for ending ageism.
So now here we'd like to make this interactive, and if everyone could type into the chat 1 to 3 words or phrases that come to mind when you think of an older person. And there are no right or wrong answers here. This is just like what automatic thinking happens for us all. And if you could just pop those into the chat, and then Allie, if you could share those with us or let us know what people are typing, because I'm not able to see the chat. But we would love to hear.
Oh, sorry, go ahead.
Oh, go ahead. No, you go ahead. If you're seeing things, that'd be great.
Yeah, we have wisdom, experienced, loss, wise, calm, lived experience, wise, experience, active.
Awesome. Wow, we have really positive words in this. This is wonderful. I think that our audience must be people that are very engaged in awareness around older adults.
Wisdom, contributor's a new one.
Nice. This is great. Okay, that's really encouraging, because a lot of the webinars that we do, we hear many more negative words than we do positive words. And you obviously all are people that are very aware of ageism to some degree. But more commonly in society, we hear negative language around older adults. And that's like the first step, is just becoming aware of that automatic thinking that we have and what words do pop into our mind when we see or think about older people. And if they are negative, that's really a reflection of the cultural narrative that is in our society. So thank you for sharing. Those were actually really encouraging. I'm happy to hear that. So today, in our presentation, when we are referring to healthcare and health, we mean the systems and structures and institutional level of what that looks like and how these impact our physical health, our mental health, and our overall well-being as we're all aging. And we know that ageism directly impacts our health in many ways. Ultimately, it can decrease our quality of life as we're aging. So thinking of it in that broader context and how ageism is impacting us across the lifespan and health in all those contexts. So that's what we're referring to here today.
Yeah, and we usually like to throw in some data to just to kind of really hone in and emphasize how important addressing ageism is. So 82% of individuals over age 80 experience ageism every day. So that's a pretty huge number, and just like what Kris was saying earlier, right? A lot of people in our society don't really recognize when they have these negative thoughts and beliefs about aging and older adults. And so those thoughts impact the way that we treat ourselves and others. And it impacts healthcare overall, because, healthcare professionals, right, as well-meaning as we all can be, a lot of the times we don't recognize ageism because it's not a well-known conversation, well-known topic that people talk about. But overall, this impacts our health as we age. It impacts us as patients, and it impacts us as for those of you who work in healthcare, it impacts us as healthcare professionals.
So now we'll take a look at what is ageism exactly. And at Changing the Narrative, we use the definition that comes from the World Health Organization, defining it as the prejudice, stereotyping, and discrimination directed towards someone based upon their age. And it can be directed toward older people and younger people. But where we see the most negative, especially health impacts overall, is when it's directed toward older people. And we know ageism is systemic. And worldwide, 1 out of 2 people are prejudiced against older adults. So it's not just a problem in the United States. And ageism is a risk factor that affects our social, emotional, and physical health. It exists on systemic and individual levels, including determinants of health, like healthcare experiences and the ability to be employed and social engagement. So we know that stereotypes are commonly made through assumptions and generalizations, especially about older people, but also about younger people. So a couple of examples are when you hear people make stereotype comments like older people have no interest in learning technology, or they're not able to learn technology. And then directed toward younger people, you may hear things like younger adults are not hard workers, or they're not loyal employees. So these are stereotypes and assumptions and generalizations. Ageism is simply it's a form of oppression based on age, and it's a form of inequity that affects everybody to some degree. And it increases the effects of socioeconomic disadvantage, social exclusion, racism, historical injustice, and other forms of oppression. And to give you some more examples of what it looks like, it would be when people make generalizations that all older people are the same. Or at a systemic level, we see policies created without regard to the needs of older adults, or also not including older adults in the conversation and the decision-making process, or believing that older people's health concerns are simply due to aging. And health concerns that have to do with age may cause us, like if you have a health concern, say something is aching and you're an older adult and you overlook it because you think it's solely because of your age, you may be overlooking important health indicators that need attention. So it's important to be conscious of the things that direct your thoughts and your decisions. So these are also all examples of implicit bias, meaning that there are conditioned patterns of thought that we are simply unaware of. And ageist beliefs begin in childhood, where we subconsciously form beliefs about people based on their age. And that's influenced by what we see from other people around us, from like books that were read to us when we're children, or what we see on television. And ageism is also attributed to feeling invisible, to being marginalized, and experiencing social exclusion. So that's how strongly it influences, impacts our lives.
So we would like, so usually whenever we run these webinars, we like for our audience to be able to participate and interact with us. So we've scattered some polls here and there throughout the presentation. So with this first one, I don't know if we're able to pull up a thing so they can click, or just in the chat box. Okay, so in the chat box, if you guys can pick true or false, I will read the question out loud. If a healthcare professional is ageist, it won't really affect their older adult patients. True or false?
Seeing a lot of false.
Okay, good to hear.
Yeah, so it is false. So there's a review of 422 studies, which that's a lot, right? Worldwide, that found evidence of the adverse effects of ageism in 96% of the studies. And like so working in healthcare, I see this pretty frequently. So, you know, just from viewpoint of like evidence-based studies, right? But also as a healthcare professional, I get to see it all the time. By the patients and also by healthcare professionals, where older adults are really affected negatively by ageism. And this is regardless of their age, sex, racial, and also their ethnic identities.
So now we'll take a look at ageism just in our lives, you know, living in the society. And here what we have is the 4 eyes of oppression and how those interplay or intersect with ageism. And when we break this down and look at it from each of these categories, so from the ideological perspective with ageism, it's the societal messaging that aging and getting older are undesirable. We see this at the societal level and in the ideological way, where it shows up in media, advertising, TV shows, movies, anti-aging products. They're some of the worst, right? To make people feel like they should not be aging. In the internalized, how that shows up with ageism are just the self-beliefs that mirror what it is that we are seeing in society. So we become a reflection of that messaging that's throughout our society, and believing that. Interpersonally, it would be the interactions that we have with other people where we feel devalued, or where someone feels devalued in those interactions. And from the institutional perspective, which is also structural, that's the barriers and limitations that show up as limiting access to care and access to resources to improve your quality of life. And so from all of these also, it reflects evidence that was found in research done by the Frameworks Institute, that the cultural narrative in the United States shows up as aging is negative, something to be avoided, and that it's a time of decline, depression, dependence, and deterioration. So at the societal level, we're really working against, we are working to end all of those stereotypes and assumptions that we see so strongly. And from this perspective about what we believe, this is really important, that ageism is one of the least recognized biases. So a lot of times when we have conversations with people about ageism in general, Like even, for example, my mother-in-law and my mother, they didn't recognize ageism when it was happening to them. It's just something that has become so normalized that you don't question it, right? And that's part of the problem. And Dr. Becca Levy from the Yale School of Public Health is a researcher on ageism, and she's someone that we think very highly of. And she wrote a book earlier this year called Breaking the Age Code, which I highly recommend. But she and her team found that our age beliefs directly impact our health, meaning that if we have negative age beliefs, then that will harm our health. If we have positive age beliefs, it will benefit our health. So that's how important it is for us to recognize what is it that we actually believe and be aware of our automatic thinking. We aren't born ageist. So when we begin to recognize that much of what we believe is influenced, and if we have negative beliefs about aging that comes from the systems and the society that we're exposed to, we can begin to shift, because awareness is an opportunity to change your negative beliefs and your biases. So this is the first step, and we're glad that you're here to have this information shared.
Okay, so the second poll, the number of people aged 65 and over will exceed those 18 and under in the next decade. True or false?
So you can type into the chat, true or false.
This one we're getting a lot of trues.
Okay.
Yep, it is true. So for the first time in US history, there will be more older adults than there will be children by 2035. And this is a really, really important data for us to know, because our healthcare system really is not prepared or equipped to take care of older adults, right? Like Kris was saying, because ageism is so prevalent and not as well known, a lot of our society really sees older adults, and I can speak to this because I see it quite a bit in healthcare and what I do, where people who are older, right, they think like, oh, well, they've already lived their lives, right? And so and Kris will kind of delve into this a little bit more later too, in terms of how this, us not being as equipped in healthcare is showing with the, standards of care and things like that. So it's very important for us to be able to advocate for ending ageism and to really bring light to the concept of ageism, because this will affect all of us in the future.
And now we're going to go into how ageism intersects with other identities in our lives, just to show the impact and the levels of how it shows up for individuals. And this is important to be conscious of each person that you are interacting with. So we know that our lives are shaped by our identities, our relationships, and social factors. And we also know that older adults are not all the same. And when we think about all the various identities and the spectrum that those hold for each of us across the lifespan, these varied identities impact our experiences. And that influences how we age. It influences our quality of life and just simply our overall well-being. And some examples, and these are not all identities, obviously there are many more. This is just a slide showing some identities that some people may carry in life, and there are more, and we acknowledge that for sure. But some examples to share with you of intersections of ageism with various identities. We know that older adults who identify as Black, Indigenous, people of color often experience poorer health-related qualities of life, lower life expectancies, and multiple chronic health conditions. And LGBTQ plus older adults are at higher risk for social isolation, depression, and loneliness. And older adults experiencing disabilities increases their risk of neglect, abuse, loss of supports, and poverty. So with each person, every person that's an older adult, or just thinking of our own ourselves aging and the various identities that we hold, having an awareness of how those identities and experiences of oppression across a lifespan impact the way we age and our quality of life as we're aging.
So ageism also affects our overall mental health. Ageism is associated with higher levels of anxiety, increased depression, having lower self-esteem, having poorer performance on cognitive assessments, and higher blood pressure. So as an occupational therapist, I tend to, so part of our scope is the cognition piece. So we would always provide cognitive assessments to patients. And a lot of the time I will always have patients who would get upset with this. I mean, I think we all would, right? Whenever our cognition's being put into question. So I have some patients who will say, I'm too old to be answering that. I'm too old to remember those types of things. As an old person, I don't even think about those kinds of things. So then they're already, it kind of goes back and forth, right? It's like the cycle of, oh, I'm too old that I can't remember what that is. And then also using it, having that belief, but also then using it as an excuse. Whereas some people who I've had patients who are, they'll say, yeah, I'm still too young to be having these issues. And, they use, like what Kris was saying, a different identity, right? Rather than using their age, they're like, oh yeah, I have a master's in this and a master's in that, or I have, I'm a very healthy 60-something-year-old. And so, having that positive belief about aging and also about themselves really just also helped score higher on these cognitive assessments, whereas patients who usually use their age as a reason to score low typically would score low, or they would just flat out refuse to use it. So, which then also, impacts them in a negative way, because cognitive assessments are very important, as part of looking at somebody's overall health. Yeah. Okay, so now we're going to go into the different types of ageism that shows up in healthcare. The first one is internalized ageism. And so this may look like a patient who is ignoring their symptom and really utilizing their age, kind of like what I was saying earlier, as an excuse, right? And so they would ignore their symptoms if they have back pain, neck pain, whatever that looks like, and using their, saying, oh, that's just part of aging. I cannot say how many times I have had patients use that and tell me that is the reason, why, I'll ask them if you have to have any pain, and they'll say yes. So we have to go through like a process in our work to ask about pain, because we need to make sure that, is it manageable? Is it something related to whatever's going on? And a lot of the patients will just brush it off and say, oh, it's just my age. It's just a typical pain that comes with being old. Don't get old. So I get that a lot from patients. Internalized ageism, I also have, currently, I have been meeting up with my doctor. I have a pinched nerve. And my doctor, I had to get an MRI done, and she called me today and basically just kept saying, poor me, because she said that I have a spine of a 60 to 70-year-old, because she's saying that that's something that's not typically seen unless you're an old person. But it's very interesting, because that's how her perspective on it is, right? Which is a very bleak outlook, I would say, because she makes it sound so bad, like, oh, you're too young for this kind of a situation. But speaking with my other friends who are also OTs and PTs, they're like, there's a lot of like 20-something-year-olds that have to get that kind of a surgery, but it's your lifestyle. It's not necessarily like age related. But, this just really highlights, right, like a belief in, with my doctor, like the way she sees aging, right? Like aging is where all the decline happens, versus other people who are like, no, that's a pretty common thing that you also see in somebody, just depends on their lifestyle. So this is a very, very important one, because it's not very obvious. A lot of people are not aware of having internalized ageism. I still have that sometimes, Kris and I were not immune to it. So it really takes, and we do this a lot, we learn a lot about ageism, especially, with the work that we do, but because it is so, it's such a part of our society. A lot of people don't really recognize it. And we grow up with, seeing ageist beliefs like on TV, anywhere on the media, right? That aging is a really bad thing. So people get scared of aging, or they tend to brush off whatever's going on with them. But overall, this is very detrimental for us because it could be something huge, right? That needs to be addressed by your doctor. So having a negative attitude about aging can decrease an individual's lifespan by 7.5 years, which is pretty significant. It decreases our physical and our mental health, and it also increases our likelihood of developing dementia. So the next one is interpersonal ageism. So interpersonal ageism can look like having different interactions with like your doctor or caregiver or just somebody within the healthcare system. So we have put different examples here. I also want to mention, every time I get to this part, I remember the blue is, they're like hyperlinks, so you guys can click on it. I think, Kris, you're going to send them the PowerPoint later on, so they'll have access to it. So if you guys ever want to look at the resources that we have used for these presentations, you're more than happy to. You can just right click or left click, and then it'll take you to it. So interpersonal ageism, these are some examples. The first one is having an assumption that all older people are alike. This can be a pretty common thing in healthcare. As an example of somebody working in rehab, providing a patient, all older adults, with like the 1 pound dumbbells whenever we do rehab with them, regardless of what they do, right? Like I've had some patients who actually love to lift weights, and unless we really ask that, right, if we just have this assumption that all older people are weak and frail, we're more likely to just give them the 1 pound dumbbells and just give them that because we assume that they can't do anything heavier. This is something that unfortunately is pretty common. Over and under treating. So over treating can look like providing somebody with a ton of different medications to address the symptoms that they are mentioning rather than really trying to address the root cause. This is also a pretty common issue that tends to happen. And, thinking about side effects and how that really affects overall health, it's very important. So it's important to really advocate for that. Under treating is similar to, ignoring a doctor, ignoring a patient's symptoms, even if they've talked to them about it. We've had webinars where patients have, or like our participants have provided examples. And there's this one that always sticks to my mind. She was telling us that she went to her doctor with some back pain, and the doctor basically told her, oh, just, it's okay, you're going to be retiring soon, and then you can just rest and not worry about it, which, I mean, that's not really good professional advice, in my opinion, as a healthcare professional. But it's a sign, right, of under treating it and not really, and just kind of minimizing the symptom and saying, well, all older adults tend to have back pain at some point in their lives, so you're totally okay, don't worry about it. Disrespecting or demeaning patients, kind of an example of that as well. And also utilizing assisted living facilities or long-term care facilities. Sometimes there are studies that have shown that the patients feel like they're disrespected and they feel like they're being demeaned because their individuality, their preferences are not being taken into consideration. And so, like some of us, right, we like to take morning showers versus some of us like night showers. Some of us are morning people, some of us are not, but, people are treated in the same exact manner, and so a lot of patients tend to have issues with that. So with the advocacy for ending ageism, we also advocate for aging in place. So that's also a very important thing. Elder speak is another big one that tends to show up in healthcare. This may look like calling an older adult terms like, "Oh, sweetie," and having that kind of like an inflection in their voice, or and I know a lot of healthcare professionals that tend to do this, not knowingly, right? They come into their rooms, because I've had people that I've co-treated with, and I'll go in there, and the first thing, whenever they talk to a patient that's older, because I work with all older adults, they'll say, "Oh, sweetie, how are you doing?" And just having that kind of tone of voice, but then they'll turn around and talk to me completely normal, and putting ourselves in that patient's like mindset, that seems very discouraging, and kind of just like, "Why are you talking to me that way?" So again, all of these are just examples, and we have lots of examples, but it just really highlights how ageism can really show up in healthcare.
Now we'll take a look at the way ageism shows up from the structural and institutional levels. And these are just some different examples, and there are more than what we have here, obviously. But we all know there is a shortage of healthcare professionals trained in the health of older adults. And it's also known that by the year 2025, which is only 3 years from now, which is hard to believe, but it's projected that the need for geriatricians is going to rise by 45% in that short amount of time. So we really need more healthcare professionals to be trained in the health of older adults. Maybe have, I know that we have a shortage overall of just employees in the healthcare world, but it's just made it worse. I mean, with the pandemic, it's all gotten much worse, and we just need more people to be trained in the actual health of older adults, in gerontology and geriatrics. Just some sort of training courses would be very beneficial. Medicare doesn't cover some of the most essential preventative health services, specifically vision, hearing, and dental. And yet we know that vision impairment can increase the risk for falls. Hearing impairment can lead to depression, isolation, and cognitive decline. And poor dental health can lead to cardiovascular disease, diabetes, or it can impact one's ability to eat food if there's pain. So if we have a barrier within our systems and structures, within Medicare, and people aren't able to access just basic preventative care for vision, hearing, and dental, it's setting people up for failure. It's setting people up to have worse situations in their health, which can lead to very expensive healthcare issues and problems. So this needs to be addressed, and that's an important thing to be aware of. And I do know that Congress has introduced something this year about including vision, hearing, and dental, or hearing, I think it is specifically, and I haven't heard the latest in the last few weeks, but at least it's being looked at. So I'd really like to see that happen, policies, so that everyone can have access to vision, hearing, and dental as they're aging. Historically, older adults have been excluded from clinical trials. And with the crisis standards of care, what we're referring to here is that when the pandemic was in full swing and things were really intense and terrifying for many people across the world, we were hearing messages that older people should self-isolate, and not interact with anyone. And that was a difficult decision to make, I'm sure, for many people that were involved in that decision-making process and wanting to ensure that older people will be safe. But at the same time, we know that being isolated leads to depression and negative impacts on mental health, physical health, and all of that. So it's important for us to look back on those decisions that occurred during the pandemic and reflect on what lessons did we learn from how those decisions were made, and what could we do next time if we have another crisis like that, where we are also including in the conversation older people's well-being, their quality of life as priorities in the decision-making process, and also including older adults in the process of making those decisions as well.
Okay, so our third poll, I think this is our last one. Does ageism impact the costs associated with healthcare? Yes or no? And if you can just type it in the chat box.
We're getting a few yeses.
Okay, good. All right, I'll share that answer here. So yes, a 10% reduction in age discrimination could lead to saving $1.1 billion annually in healthcare in the US. So also to add, that 10% reduction could lead to 320,000 fewer cases of the 8 most costly health conditions for people age 60 and over. So there's a financial reason to help us end ageism, you know. So what can health systems do?
Okay, so we can, healthcare is kind of switching to this concept of person-centered healthcare, where we tend to focus more so on the quality of the care that's being provided. And so, it's very helpful to be able to think of we're switching to thinking of the person, the patient, as an integral part of the team, right? Without the patient, we wouldn't really be there. But in addition to that, the patient is, the expert in their body and what's going on with them. They're the ones who are able to tell us what is going on. So it is very, very important as a healthcare professional to really be respectful of what their preferences are. Ask them, what are their goals? What are they striving to work towards? What do they want to get back to? What are what's most important to them, because then we need to be able to really take that into consideration whenever we provide our treatment plans, whenever we come up with our goals for the patients, right? So it needs to be this like teamwork, rather than the healthcare professional being the sole expert and telling the patient what needs to happen. It's very important also on the other side of that, for the patient to be able to advocate for what their needs are. A lot of the time people tend to defer to the doctor as the expert, right? And then they kind of just like take it in and listen and say like, oh yeah, this is what my doctor wants me to do, this is what my doctor thinks I should do, and then they don't really advocate for what they want to do. And that's also very important, because as the patient, they are the ones who are going to be living out the rest of their lives. It's their quality of life that's on the line. So as healthcare professionals, this is just, very important to address. Also, understandably so, like what Kris was saying, there's a shortage right now with healthcare professionals. People, with all of that, there's just a lot going on in healthcare at the moment, and it's difficult, right? Sometimes to really think of being person-centered, because you're so busy. When we're so short, you kind of just try to like run and see everybody and get through all of your patients, right? And there's a lot that comes with it, including documentation, those kinds of things. So sometimes it's very difficult, but that's also why it's so important to really come in with that mindset of like, for me, I always think about it in terms of like, if this were one of my loved ones, like my mom or my siblings or my grandma, how would I want to treat them, right? So I think that kind of puts things in perspective, and really allows us to provide really good care for our patients in terms of, really looking at them as individuals.
Yeah, and to add to what Gilliane had mentioned earlier about older adults themselves, and if they have caregivers or supporters also in their lives, that you had mentioned like working collaboratively, right? Just like speak up for yourself, say what it is that you need, or whoever is there on your behalf. And it's hard sometimes for people to take that kind of assertive role, but also knowing that healthcare, the systems are overburdened right now, and it's definitely a really challenging time. Maybe it also be helpful if we as individuals, as older adults, take that more assertive role and think in that collaborative mindset. And how can I step up and say, here's what's important to me, and I'd like to have guide or have a part of the decision-making process in the care that I'm receiving. If you're able to to work with me, that would be great. You know, just something to help guide the conversation in a way that actually does reflect what your wishes are.
Mhm.
And then kind of in keeping with the person-centered care model, we also look at the age-friendly health systems, which comes from the Institute for Healthcare Improvement in Boston. And they have the 4Ms framework, which if you're not familiar with, it's a decision-making process or a way of guiding care that's it's inclusive and collaborative. And it focuses on the needs of older adults and the way that care is delivered. So in this little diagram here, the most important thing that guides this framework is what matters most to the patient. So what is aligning with their unique goals and preferences for the health that they're looking for, the quality of life that they're looking for, and just what can guide the conversation. And also it's been found that if you lead with that question at the beginning of an appointment with someone, that can help focus in and hone in, you know, on what is really most important to this person right now and help them have a role in the decision-making process. Mentation is referring to preventing, identifying, treating, and managing depression and delirium. Mobility is referring to ensuring that older adults are safely able to move about so that they can do what matters most to them in their lives. And medication is reflecting that if medications are necessary, use the ones that don't interfere with what matters most to them and their mobility and their mentation across all the care settings. So these things are all interrelated, and it's just a great way to guide the care that's being provided. And if you're not aware of the IHI, I highly recommend you check out their website because they're a great organization. And then here, just what can we do to advocate for just on the institutional and structural level and policies that are being decided upon. Advocate for age inclusion. Just pay attention to if you're seeing that or not seeing that. Advocate for culturally competent policies. Be aware that people all have different identities and life experiences, and that needs to be included in what's being written as far as policies go. Include older adults themselves in the healthcare policy discussions so that they can have a say in how things are being directed. Learn about intersectional inequities that exist for people across the lifespan. Expose healthcare students to older adults during their professional training so they become aware of what it's like to help provide care for older adults and how that can be different than younger people's care. And conduct workshops about ageism. We at Changing the Narrative, we actually have a couple of different toolkits that are free to anyone that you can download and conduct your own discussions with people at work or just in your own personal life.
So what can we do just as, community members, right? So as advocates, we can learn more about ageism. Like Kris was saying, Changing the Narrative's website is full of resources, and they cover so many different things, not just ageism in healthcare, in the workplace. There's so many different ways to advocate for ending ageism. And you guys can always also reach out to Kris about that. YouTube also has a lot of resources and videos that are actually very interesting to kind of go over different social experiments to highlight ageism. And it's very eye-opening because it really just shows you what I was mentioning earlier about internalized ageism and how that bleeds into our interactions and how we treat specifically older adults versus, younger populations. Becoming aware of your own beliefs and your implicit biases, it's very important, like I was saying, because it affects your interactions with other people who are, depending on what their age is, right? It also really affects how you see yourself and how you see aging. There are so many people because of ageism and because of how it's so, and how it's just in our society, right? It's pretty insidious. We don't understand that it's it's all over. It's all in the media. It's, like in social media, you see a lot of, videos that talks about how aging is not a good thing, right? Like there's a lot of different ways to describe older adults as frail and weak, and how it's not a good thing, even down to things like aging creams, right? Like different like hair color, because gray is not a good thing, right? So becoming aware of that, because it does affect the aging process for us and our quality of life as we age. A lot of people who have negative beliefs about aging are very afraid of getting older, and when they do, that really, if you think about it, it really affects our quality of life. It really affects our abilities. It affects the potential that we have as we age. A lot of people stop doing things for themselves. I think we have some time, but one quick example that I had a patient who had such negative beliefs about aging that when he came to us, he just kept saying, I'm too old for all of that. I can't do this. I can't do that. And even like simple exercises. And unfortunately, he just progressively, worsened, and to the point where he ended up having to go to a long-term care because he could no longer do anything for himself. He just became bedridden. He didn't want to get up anymore. He just, and there I could see not just the physical toll, right, but also the mental health toll of it, because then it's a cycle, right? And one affects the other, and you can't just separate it out. So just having that kind of a negative view on that really affects us. But on the other side of it, I had this one patient. She was in her 80s, and she was just the most pleasant person ever. And she was just incredibly positive, never allowed her age to be a barrier for her. And she would always say that she's young. And I mean, even with like health concerns that she had, she was very determined to be able to go home, to get back to her life, to have a good quality of life. And so she was always, she never really utilized her age as a barrier. So she was able to get out of there relatively quickly. She was in her 80s. And the other person that I was talking about, he was in his 60s, late 60s. So, it makes a huge difference, right? How we see aging. Don't make any assumptions based on age for the reasons I had mentioned above. Advocating for age inclusiveness, choosing words intentionally, using the term older adults rather than saying elderly, because there's different connotations that come with the words that we choose to utilize, right? And again, that kind of just, it makes a difference of, older adults as in somebody like what you guys were saying earlier, wise contributor, right? Versus elderly, frail, weak, makes such a huge difference. And also sharing what you've learned. Again, if you guys want to be involved in these workshops, if you want to run one of these with Kris, you totally can. So just reach out to her.
So here we'd love to have you add into the chat. What will you do to help end ageism? Just any ideas that you have, even if it's just, thinking about the words you speak, or paying attention to what you're seeing out there in advertising or in movies or film or whatever, and just help share that with your friends and family or coworkers. What's maybe one thing you might each do to help end ageism? Any ideas, small or big? We'd love to hear.
I added in the chat, sharing what I've learned and speaking out against ageist rhetoric. Some others have been educating others, words that I use. Educate by doing a class for older adults. Deanna O'Connell would love to partner.
Oh, nice. Great. I would love to. Thank you. Great. Yeah, I'll be happy to share my email in the chat too. If anybody wants to reach out and do a co-presentation with me, I'd be happy to do that. But those are great answers. Thank you for that. And so here is just a call to action. If anybody wants to request a presentation like we did here today, I can do that with you. And also, if you want to utilize the free toolkits that we have on our website, you can feel free to do that as well. And I can send you information about what that looks like and assist with that if you'd like it. But we have time. If there's questions, we'd be happy to answer any questions, and we can, if people want to unmute themselves and ask them or type them in the chat, we can do that now.
We had a request for the website, but it looks like it is up there. We can also send it out when we send out the video.
Okay.
Recording. But everyone feel free to pop some questions in the chat or unmute yourself and ask your questions.
Hi there, I'm Deanna O'Connell.
Hi.
From UC Health, and I teach I'm a health educator for older adults.
Oh, excellent.
Yeah, so yeah, I guess I'm actually looking to do a class that is related to educating on all of this, as well as a focus on empowering. How do we become empowered, and people who have been used to the narrative all of their lives. So I teach mindfulness and I teach nutrition, and really mostly what I do is behavioral change. So anyway, that's what I would be interested if you are interested in partnering to come up with a class like that.
Excellent. I would love to do that. Yeah. So the class, it would be primarily older adults themselves, right?
Yes. Yes.
Okay. Yeah. I've got materials already, and I would be happy to do that with you. That would be wonderful, because we have great recommendations to empower people.
Yeah. Okay, good. Yeah, that would be awesome.
I put my email in the chat, but so if you want to take that and then email me, then I can email back to you and we can work something out. That would be super. Thank you.
Okay, good. Thank you.
Yeah. Any other questions popping up?
Nothing right now.
Oh, go
ahead.
Yeah, I was going to say somebody asked for the website in the, Deanna asked for that. Yeah, let me see if I can stop sharing.
And I see it on this
Oh, you do?
here.
Okay.
Yeah.
Great. Okay. So yeah, I can never remember if it has the CO at the end, but I think it does. It's like changing the narrative, co.org.
Okay.
Okay.